A new breakthrough that may save many children from leukemia.
Dr. Bruce Hensel has the story.
Your beautiful fingernails.
Lisa DeLong takes special care of her son Jacob, who was diagnosed with leukemia in 2006.
And I immediately started sobbing.
Because I didn't know why was she crying. And then she told me, and then I started crying.
He was quite sick, as just about every child with this disease is initially, and without treatment, he was certainly in danger of dying rather quickly.
Dr. Stuart Siegel says Jacob responded amazingly well to treatment.
Jacob responded very quickly. He obtained a quick remission, which means his bone marrow returned to normal as far as we could look at it.
Jacob's been completely well ever since. But the whole family lives in fear that what happened to Jacob's older brother Justin will happen to Jacob. Justin had the same disease and the same good response to treatment, but then he relapsed.
Justin was the oldest in our family, so when he died at the age of 15, they were old enough to know what was going on.
It's extremely hard dealing with a sibling with cancer.
So what are you going to do today?
Which is why the whole family was ecstatic when they learned Dr. Marcus Mersham had made a breakthrough, which may explain why some kids who relapse no longer respond to treatment and die.
We discovered the BCL6 gene, and we think it protects the cells from chemotherapy and makes them resistant to drug treatment.
So if a child does relapse, he or she might be tested for the gene and then given a new drug that overcomes the resistance.
What it means to me is that my son Justin, who died in 2000, he would be sitting next to me instead of being buried at Eternal Valley.
It's a very visual picture.
Siegel says it may yet save the lives of many others.
I think if this works for this subset of leukemia, there are going to be hundreds of adults and children every year who are going to be able to be treated successfully for their leukemia and go on to live normal, productive lives.
I'm really grateful that they have this now so that if Jacob were to relapse, it's another thing that could help him.
It'd be better for the kids with cancer and try not to suffer anymore.
He was in the midst of treatment. I thought
Lisa, who chronicled the family's struggles and triumphs in a book called Blood Brothers, hopes there's one more chapter to come, a very happy ending.
I still have Jacob, and this discovery means that, you know, in the event of the R word, in the event of relapse, we have another weapon that could be used to save his life.
Researchers still need to test the gene and possible treatment on children before they are sure if it can save lives. If it works, it means the addition of only one drug might prevent or treat relapse and clearly save lives.
The researchers are careful to point out it might not work on all children who relapse, but it is clearly a potentially life-saving breakthrough.